Who are we? Depending on your perspective, we are electronic medical records, patient engagement, revenue cycle management, or population health. But we're really much more. And that is the definition and the magic of synergy, the creation of a whole that is greater than the sum of its parts. We are a healthcare information technology company. We are healthcare, tools that improve access to quality, affordable care, that make the delivery of care safe, measurable, and effective, that help doctors realize a positive return on their investment, and that improve the overall health of our citizens. We are information that is both powerful and personal. Powerful enough to manage the health of our largest cities, and personal, too, providing a unique health record for the more than 200 million patients who have their medical record in eClinicalWorks. We are technology that is always on and always available when and where you need it. Technology that is designed to be used to improve the health of individual patients, to improve the accuracy and efficiency of healthcare providers, and to reduce the cost of healthcare for all of us. We are eClinicalWorks, delivering healthcare information technology solutions for today and tomorrow. It is who we are. It is what we do. Every day, working with you, improving healthcare together.
Thank you for coming. 4,500. And somebody just reminded me a few minutes ago who had been to the 5th 5 years ago, and so we had 450 of us here. That was also in Orlando, actually. But thank you for coming. You know, it's moments like this that make me go another year. So I got to capture it. You got to take them and memorize them forever. So what do you do nowadays when you do that? You take your camera out and you go, let me take a picture of the audience. And then they'll ask, if you do that, how will people know you were there? So you take a selfie. And then what you do after that is you send it on to Twitter. And then you assess the success of your conference by the number of retweets and likes you get on Facebook. Isn't that amazing? So why don't we just do that? Why don't we all smile for me to take a picture of you and me right in this selfie right now? Is that okay? Yeah, great. One more. Front person's not smiling. That's okay. I'm going to send that over, and we'll touch base later for the ones that were not smiling in that picture. But it's been an exciting year for us. There's a lot to do as well going forward, but let's get started. 4,500 attendees, 49 states. We actually tried to get the 50th one here, but we just couldn't. We tried. We don't want to name that. 5 countries for the first time visiting here. Customers, 140 sessions. Learn a lot. 450 eClinicalWorks engineers, support staff, trainers, product specialists. Mingle with them. Ask them questions. 50 exhibitors, hands-on training. It's just full. And now I can officially start my talk because they're going to reset the clock, because else I'll keep going on for hours talking to you. So Robert said it nicely. I'll say it. You're not leaving your chairs till it's done. So when we look back at 14, we say it's a year of many successes. Successes in both us making and developing technology that we deliver, and you in deploying them. So let's take a look at some of the things that happened in 14. I, on a personal basis, actually got invited to go back to my alma mater, Boston University. Not to attain a degree, but to actually be speaking as a convocation speaker. That was fun. You know, I never write speeches, never. That was the first time I did it, and that was hard. So you asked me how to wait today and yes, that one, I can't decide. On the business side, things did well as well. Our EHR, our core, the one that allows us to work with you and the foundation of our business, is continuing to gain a lot of momentum. Large physician practices, we just announced today, Toledo Clinic, 190 providers. Last month, Rothman with 450, Palmetto with 250 providers. These are large independent physician groups, all picked eClinicalWorks from other EHRs. Health centers, now we have 55% of health centers in the country on ECW. And I know many of you are here. Hospital systems and their employed groups, we're having momentum with them as well. And then the best of them all, I always say, small physician practices. You make it happen. You make it happen. I would rather see a louder applause for that group, but 1,000 new practices last year picked eClinicalWorks, making us the largest independent physician EHR in the country. Correctional facilities, employer clinics, and we now actually have international customers who are using ECW as well. All in all, a good, successful year in terms of the EHR business. But we've also been investing in 3 verticals, like you know. Our revenue cycle business is doing well, extremely well, at 2.9% of collections, been averaging between 91 and 93% first pass acceptance, with pretty good days in AR across 50 specialties. We've introduced some new technologies that I think you should go explore while you're here. Pop Health, you'll hear a lot about it at the conference. There are so many ways to describe this. Well, let's put some simple ones in. 2 years ago, we were not in this business. We had experience with some customers trying to understand population health, but we were not really in this business. And today, we're actually leading it. 100+ customers that are doing shared savings programs with payers are now using eClinicalWorks as CCMR for managing population health. And there was an award and recognition done, I think, 2 weeks ago by Frost & Sullivan that rated us as one of the best products in that space. And KLAS came out with a study earlier in this year and said we had the deepest product when we compared it to everybody else in this space. And the best part of it all is it layers well on top of the EHR, but you could actually use it standalone, even if you're not an eClinicalWorks EMR user in an accountable care organization, and many other risk programs. Moving on, patient. You're going to hear a lot about this today. You are one side of the coin, they are the other side of the coin. And it's the two coming together that make magic. We announced a couple of years ago a significant investment in the patient engagement space with the creation of Hilo, a wholly owned subsidiary of the company. And they've had some amazing successes. From a financial standpoint, we've committed $75 million in R&D to this arena. We're not going to back off. We believe this is the area where your customer needs to have an unreal experience working with you. 35 million patients now, thanks to you, have an online account with access to their personal health information. That is spectacular in itself. Just last month alone, 12 million reminders, whether they were for flu shots to come in, whether they were for mammogram screenings, annual visit reminders were sent out, having patients figure out what they need to do with their care. We support every modality now, from voice, email, text, and we'll show you video as well integrated today. Hilo is here. Somebody actually commented, am I at the eClinicalWorks conference or am I at the Hilo conference? I think you'll see both very, very vividly displayed. So yes, all 4 areas of our business continue to do well in 14. We also have the NFL live. Joe is here, all 32 clubs. And SeaWorld has started implementing ECW across all its national parks, 6 locations. That's pretty amazing. Yeah, I missed the game last night. I thought I was going to see it, but then I saw the blocked field goal. So those of you from New Jersey, I apologize, but I'm from Boston, so I just loved that game last night. Yes, yes. Yeah, field goal, 5 seconds to go. I was right here preparing, looked it up. So let's keep going. All in all, good. But those are, I think, just business successes. I also think 2014 was a year of a lot of hard work for both of us. Government mandates and meaningful use, HCFS forms changing in April, ICD-10 that came as a cloud and has kind of gone away a little bit, but nonetheless took away a lot of mind share from both sides. But we have to do that, right? You can't just focus on innovation. You have to focus on execution. 2014 was many successes, in the best way I put it, and a lot of hard work. We rolled out V10, the platform that most of you are on today, to 10,800 customers in less than 9 months. It's more than 1,000 a month. For those of you that wanted to know how we'd handle the support questions and requests, we did pretty darn good with it. We are past it. We are actually seeing now V9 compared to V10, 40% fewer requests to have issues or even how-tos. We think we built a pretty solid foundation that runs on a PC, that can be accessed on a phone and can run on an iPad. And I'm hoping I get to the 100% before the end of this year. That'll make for a pretty significant achievement and a lot of hard work for V10. We've also seen something else with the rollout of this product. Increased adoption and use. Touch, which is the iPad-centric product, we're working on Surface as well, but 5,000 doctors now use it in their clinic for seeing patients. Let's rewind the clock. 3 years ago, the product was in development. The network of referrals, so that you can send electronic referrals between primary care and specialty care, has jumped from 19,000 at this time last year to almost 43,000 plus this year. And the use of mobile users, the folks that carry the phone outside the office, doctors, staff, to access schedules, look at medical information, address labs. We'll show you some new things there as well. 30,000 physicians now use it. And I love it because it's a free product. So V10's accelerated the adoption of these. And we continue to make more investments in add-on products that you're going to see today. But the cloud is the big deal. And that's where I think the biggest investment for ECW went in 14. In data centers, in upgrading infrastructure, in putting in state-of-the-art that we need for the next 10 years. And that investment was significant. But I was asked a question. I went to California after a long time this year. You know, I actually debated whether I should wear that same outfit. And somebody said, no, they'll look at you and they'll go by and say, he's got one suit. So I decided to wear something else. I was in California, dressed like a Californian does, tan shoes, light suits. But I was asked a question, what do you think about cloud computing and the future of cloud in healthcare? I couldn't come up with a better answer, so I tried to give them an analogy, and it was as follows. I see the electricity today in every outlet, and you just plug in what you want to get powered up, and you get your power, whether it's to charge phones or whether it's to charge appliances. It's just available all the time, and it's available everywhere. I think the cloud computing environment is going to be that way if it's already not, available to charge and power information all the time, everywhere. Now, if you and I believe that we are going to put individual diesel generators in each of our homes to generate electricity and power them, then client-server computing has a future. Because then you and I can put individual servers and run our cloud infrastructure that way, in-house. But I believe that's not how electricity migrated and moved. Eventually, you go to something that's bigger, generated in power plants. I think cloud computing will run in data centers, and you will access your health information technology and your patients on the cloud. It's just a matter of transitioning to it as fast as we can. So the investments in 14 were significant in this space as well. Our grid is now in 9 different geographic locations. We cover East Coast to West Coast. You know this net neutrality debate that's going on? Should the internet be different speeds for different providers? Our theory here is you can't guarantee performance by putting a data center in one geographic location. the internet is just not that good enough. You don't generate electricity from one power plant and distribute it to the whole world. You do it in different geographic locations, so it needs a grid. eClinicalWorks Cloud has got an amazing grid across 9 geographic locations connected to each other. We've also made a decision to be a private cloud company versus a public. What it means to you is that your data will always be isolated and separate from another customer's data. And we will never sell your data for profitable intent as a company. That's your information. You keep it. You decide to share it. That's your prerogative, not ours. And that's why we don't do free EHRs. We do EHRs that generate value for you, but we never sell your data. And the last part of the cloud is downtime. The internet can have its ups and downs. What we have decided is to provide downtime procedure to every one of our customers in the cloud with Nimbus. It's free, it comes with the cloud. If you have a challenge, if you have an outage with something that's specific, you can move to another place and access Nimbus, which at least allows you to go through your day. These investments that were made were never, ever made in a way to charge you extra for them. We just believe that's part of doing business. These are our successes in 14. What about yours? I'd like to play a video next of 3 customers that gave us access to come visit them and tell us about their stories and what they've been able to achieve last year with the use of technology. I think it's going to make you quite emotional when you hear to some of them. And some of them are funny as well. So why don't we take a look? Let's roll the video. I'll come back and we'll talk about 15.
My name is Karen Nance, and I'm an internal medicine as well as a bariatric physician in Schaumburg, Illinois, which is a northwest suburb of Chicago. The medical landscape today is challenging. We all know that we're being asked to do more and our outcomes are being measured, and we really need to figure out how we can work smarter, because we definitely can't work much harder. So because of my EMR, I've been really able to streamline my workflow, keep my overhead at a minimum, and be able to successfully have a practice where both my patients are happy and I can feel like I can still go home and be the mother and have a family life and a personal life that many doctors struggle to find. There are so many patients that we've been able to get off insulin who were on insulin because of diabetes, people who have come off blood pressure medication, off lipid medication, and without a system that enabled me to institute particular protocols and then look back on those protocols and understand how did what I do make an impact, there's no way that I could know that I was actually making that difference.
Hi, I'm Dr. Rick Singh. I'm a family practice physician in the southwest suburb of Chicago. Our medical practice group has been on eClinical. We went live in 2009. Prior to that, I was employed by the hospital and we were on MISIS. My introduction to eClinicalWorks was I was so frustrated with MISIS because it was rate limiting how many patients I could see. I wanted to be the rate limiting step and not my EMR. I'm a huge enthusiastic supporter of integrating technology into practice of medicine. Our patients have been very, very pleased. We've actually quadrupled our practice size since going live on eClinicalWorks. To kind of illustrate that point, I have an example of one of my patients who's been a long-time patient. He actually travels quite extensively domestically as well as internationally for his employment. He has a history significant for asthma. He was actually coming home on a flight from a long business trip. On that trip, he realized that he didn't have any of his inhalers, and he was starting to have some mild difficulty and acute exacerbation of his asthma. He did realize that he was on a plane that had Wi-Fi, so he quickly connected, went on Helo, and actually contacted myself. I received his web message, was able to see he was in some distraught. I was able to locate a local pharmacy near O'Hare Airport, and I called in all of his medications and refills for him. About an hour later, I did receive a message from the patient stating that he landed safely. He went to the pharmacy. All his medications were there waiting for him. He used all of them. He was actually feeling much, much better. That he would follow up with me in 1 to 2 days for evaluation. And he had 2 comments. One was he couldn't believe how incredibly fast we were responsive to his acute distress that he was having on the airplane. And secondly, he was very impressed with the way we integrated and fused technology into medical practice for his quality of care. So I sent him a message back stating, that eClinicalWorks is flying into the future, and it's because of it that we were able to provide such rapid and quality care.
One of the impressive things about eClinicalWorks was that they really listened to us. eClinicalWorks was genuinely interested in the way that we worked, and he wanted to know what we needed to be able to serve our patients.
You used to be up to 43 of a BMI.
Yeah.
You're now down to 37.
We were there before electronic records. In fact, we had a medical record, a dental record, a behavioral health record. It was very difficult to organize information.
55% of the health centers in the country now have deployed eClinicalWorks. The fact that health centers have adopted technology at that high a number already speaks to the mission, that you provide great care, technology helps further that care.
We're so proud to be in partnership with eClinicalWorks. It's his vision that has helped to transform healthcare in the United States.
We are deeply committed to health centers. It has a special feeling in my heart. They provide care to the underserved. You have access to doctors who are deeply committed to making sure these patients are treated well. If you just ask the question, how many patients are being seen every day where technology is having an impact, and you start making that the barometer of success, then it's just tremendously satisfying. That's the impact of technology and providers working together. Software alone won't do it. The provider alone won't do it. It's the confluence of the two working together that makes a difference in care. Yes, technology alone won't do it. It's the partnership. And if you measure success one patient at a time per day, it's 1 million now, if not more, per day that you all see using technology that we've delivered to you. Where do we go? Where do we go? What's 15 look like? I joke about it inside the company and I say, we're going to be in the post-meaningful use era in 15. That doesn't mean it's good or bad. It just means that our mindset will change to thinking about other priorities and not just meaningful use. I think if we take a look at everything around us outside of healthcare and ask, what's changing? You'll notice that almost every industry is trying to create an ultimate customer experience. We'll go through a few. I know you keep telling me healthcare is changing. I see actually a time where healthcare will also focus on creating an ultimate customer experience, which is your patient. Let's take a look at some other places before we dive right into healthcare. Let's look at devices, because you all use them in your practices every day. You know, in the mid-90s, if not the early 90s, the PCs were like the hottest thing that came out. Didn't matter which company produced them, but they were the hottest thing. And we thought that form factor compared to the mainframe was so significantly more advanced. And then it changed on us. And then the laptop came by. And the laptop's form factor started enthralling us, if not captivating us. And we were so amazingly infatuated with a device that we could take wherever we were going. That form factor also is becoming kind of obsolete. And now people want to carry tablets. iPad, Surface, doesn't matter, some other company. But touch seems to be becoming a form factor that a lot of customers, a lot of users, me included, find very, very useful. Have you ever asked this question? What was the catalyst behind this change? Why aren't we just still using VT terminals with mainframes with the green text on them? And why don't we find that to be the useful experience when we use devices? It's because it's not the ultimate customer experience. And let me ask you something else as well. What would be the use of an iPad without the internet? What would you do with it? Nothing. Two things happened. Ultimate customer experience, catalyst, the internet. Changed devices. Let's take something else. I'm going to make you go down some memory lane. You're going to enjoy this. Music. We all listen to it. We all love it. It lightens us up. It soothes us, whatever it is. Remember those days when we used to buy the records, the big ones? I might be dating myself. Some of you might not know what a record looks like, but a lot of us do. You put them, you spin them, and you move that thing right on exactly, and it plays. And you're so much in a zone. I still think that's the funnest experience doing it, but not a lot of people do it now. That changed. And the cassette player came in the cars, and we were so delighted. We put them in, we pop music, we listened to it. And then we couldn't put enough, so we went on to putting CDs because we could put a lot of them, and DVDs because we could put a lot of music on it. And in such a short period of time, even that's becoming obsolete. I don't know how many of you now use a DVD or a CD player to play music or watch. It's all moved to the digital era where you just stream music. You don't even download it anymore. You stream the song you want. You listen to it when you want it. What happened? I think the ultimate customer experience again came into play. And the internet created the change. Because without the internet, you wouldn't have had streaming videos or streaming audios. Now, this one's another one that's interesting too, television. How many of you know the antennas that you and I used to put behind television sets and then try to move them? A lot of us do? We do, right? And what was the most exhilarating moment of that antenna? When it gave you the perfect color and you said, that's the best. Till some rainstorm came by and it wouldn't work and we had to go back and adjust it. And then they came with some smarter ones that could adjust easier. But we all learned how to do antennas. And then we said, that's not good enough. And we moved to cable TV. Put it in, 200 channels, remote control, a cable plugs right in. You're at the mercy of the cable operator to come and put that box in, and you only have one provider. And that changed on us. And the smart TV came into our homes, which just runs on Wi-Fi, and you put on Netflix, or you put on something else that you love, and you watch the show you want to watch at the time you want to watch it. True? I'm addicted to it. The reason I exercise is because of House of Cards on Netflix. It's become my show. That's the one I watch. And I can go an hour now till the show finishes. And that's amazing. But my point being, I don't have to exercise at 9:30 in the evening when that show would come on. I can exercise at the time I want to because I can put the show on when I want to. And I can resume it at another location, at another time, on another television because the cloud, the internet, changed the whole viewing of television. Is it true or not? So what happens next? Let's look at commerce. These businesses wouldn't exist without creating the internet's catalyst, or the internet being the catalyst for them. There wouldn't be an Amazon without the web. There wouldn't be an eBay without the web. There wouldn't be an Uber to hail taxis without a smartphone and the internet. These all examples were given to make one convincing point to you, that industries change, user behavior changes to create an ultimate customer experience. And the internet is the catalyst that drives it. That's the trend that we are a part of. You're going to see that in healthcare. Healthcare is going to change. Not because of meaningful use, not because of ICD-10, not because of a government-sponsored regulation. We'll comply with them just like we do when we buy our cars and take registration stickers to make sure that we pass the emission control for the state laws. But you and I don't buy a car thinking that that car will get registered fast enough, so I'll go buy that one. You buy the one that you think you like. I think the same thing with healthcare. We want to create technology in ways that you find intriguing to use, and not just because of government mandates. I want each one of you to close your eyes. There are no more slides for a few minutes. You don't have to see anything. Just have to imagine if you can do that. I'm going to give you 5 examples. Think about each one and see how it touches you in healthcare. First, you have an abnormal lab result that you want to send a patient. What do you do today? You go into eClinicalWorks, you review the lab, you find it abnormal, you create a note, nurse, call patient, or call him and schedule an appointment, or you pick up the phone and you call. And that's so much better than the paper world where you just didn't know if that call ever got done, because when you mark the telephone encounter as addressed, you feel absolutely convinced that you've created a great experience for you and your customer. Not true. Not true. Why don't you instead think about that lab after your review goes online? But you go, that's an abnormal result. What if the patient never reads it? That's not a problem. What if at a stated timed interval, a minute, a day, 2 days, the system sent a voice reminder to the patient saying, you have an abnormal lab result. Or you have an urgent message you need to read that's online. And if the patient does not respond to it, then technology creates an action for your nurse to call the patient. Which of those 2 experiences is what your customer would expect? The latter gives you faster response. Let's take another one. It's more funny. You and I all have navigation systems in our cars. We do. If not in the cars, we have our phones now. If not, we plug them on the dash and we mark them in the windshield and we try and navigate our cars that way. Let me ask you a question. If your navigation system was a minute behind where you were, just a minute behind where you were. Yeah, you're chuckling, right? What exit would you take? I think if each one of us in this room had that navigation system, I'm safe to say you wouldn't be here. You'd be somewhere else. Yet in healthcare, our analytics, the dashboard that drives decision-making for providers, is not a minute behind. It's 30 days behind, sometimes months behind, and then we tell our physicians, why don't you improve care? And they ask, where's the dashboard? Where's the navigation? Why don't you help me get real-time information in my technology so I can make the right decisions? It will change because you will demand it. Third, you go into social history today. This is relevant, actually, so I'm going to spend time describing it. You go into the travel history part of social and you say, patients traveled to West Africa. Or you put in another geographic location that the patients travel to. Or you're updating your med list. And you're saying patients taking Avandia. And you know what fascinating stuff happens with EHRs? We do a great job of whatever you just told us and put it onto a progress note in this amazingly beautiful font, Arial 12, so all of you can read it. It is so much more advanced than the paper world because now you can all read it at the same time. And what an amazing experience. Wrong answer. Why don't we evolve technology to another level and ask, when I put travel history, West Africa, why doesn't the EHR go to the CDC's website? Why doesn't it make a real-time query into that system? Why doesn't it come back with a health alert and says, stop, do something? So we're not fighting whether this information is read, but the systems of tomorrow will leverage cloud computing to bring information in while you're making decisions, not after. 2 more. I know it's long, but 2 more. Ratings and video visits. You all FaceTime and Skype. Many of us use it. I'm seeing providers now that used to offer home health with physical nurses going post-op to homes to try and get the post-op visit done, leveraging telemedicine. It's easy on the patient, it's easy on you, And better yet, it actually makes you money if you're in a bundled payment because you don't have to follow traditional protocols. And lastly, ratings. In the world of the web, if you want to look for a restaurant, what do? You go to Yelp. Maybe. Go somewhere else that you like. But you go open it up, you look at ratings, and then you read these subjective information, page after page, about what people think about that restaurant. And quite frankly, you hate it if you're a restaurant owner and you realize it's actually your competitor that's posting on that website. Oh, that's true. That's true. Let me make it personal so you get it. How many of you have felt that when your patients sometimes rate you on health grades, you go, that wasn't true. I didn't take 30 minutes to see that patient. What's going on? You know, we sometimes feel the same way when a few of you post those ratings on class and we go, what the heck? We did a better job than that. But that's okay. Ratings on the web are important. Yeah, you can chuckle aloud. It helps me too. You don't have to be patiently quiet. Ratings. I think a future EHR technology allows you to take information objective, not subjective. What has been the average duration of your patient visits? How long does it take you to respond to phone calls? What are your quality indicators for chronic conditions? Other parameters that you think your patients would deeply care for, visible, and if you like them, you will publish them to the web. And patients will find you with objective information and not subjective evaluation. And I think that would be a win for both you and us, because technology would have made the difference and gotten the right information out. I think these changes that I just talked about are not for 10 years from now. They're not 10 years from now. We want to do these with you next year. We will show you today a product showcase that addresses each one of those examples I cited. And you will say, it is creating an ultimate customer experience. And you will also say that the reason these use cases work is because of the internet. That's the catalyst behind creating the change. We will make healthcare faster, you and me. We'll make it smarter and safer with public health integrations. We'll make it convenient for both you and your patients. That's inside. So what do we do? Let's look at a step-by-step structure to it. First, you have to implement an EHR, because without digitizing your office, you can't take the next step. And an EHR that's more mobile is better. Runs that iPhones, Surface, iPad, use the Wi-Fi, use the cell signal, and then something that you can carry in a mobile fashion inside your exam room. I do not like Citrix terminal emulation-based systems. I think they slow us down. I think the world's about leveraging the World Wide Web to do your EHRs in your office. Step 2, you will have to deploy technology to engage your patients. Many of you are doing it. We are putting a lot of energy behind it. You have to have your patient get updates real time on their phone as to what you want them to do, and vice versa. I know you go there, keep asking me questions, how can I keep up? But let's just assume that payer reform will come and that televisits won't be free forever, and that you responding and taking care of chronic conditions will have an incentive. There is. You will deploy patient engagement tools. We're going to show you Hilo today, and everything we've done in that space, you're going to like it. Third, don't start measuring success one patient and one visit and one E&M code. Start looking at analytics in real time. Have an understanding of how you're doing, and a system that analyzes data and feeds it back into your EHR so you can start changing your workflows with care teams instead of just the traditional nurse-provider interaction. Step 4, buy technology that integrates to public health. This is going to be important. And lastly, don't do anything that doesn't leverage the cloud computing platform to enrich, if not make your system more intelligent. That's what we are all about. So I asked this question, who are we? And most of the time I get told, we are an EHR company. That's what you do. That's who you are. Well, that's fair. I wouldn't say we are not. but I think we are a lot more than that. We believe that healthcare technology or information technology is the real catalyst for transforming healthcare. It's the way you connect the consumer of care, which is your customer, your patient, and you in ways that you and I have never imagined. It's an EHR in your office. It's a patient app on the patient's home. It's home monitoring. It's the integration. It's the analytics. It's actually one more concept beyond. Let me explain this. You know, when big retailers came into geographic locations, the small vendors struggled to keep up sometimes because they had the power of size and scale. You and I might have something to say about that as well with some trends that we see in healthcare with systems in our geographic location. But then came the internet system commerce products, and they created a customer experience that now makes the big retailers as well nervous because they can't keep up. We want you to get on to the Hilo network. We want you to deploy eClinicalWorks and join the network and build a referral pattern and create geographic masses where your patients can essentially interact with you and create that same experience Amazon did for its suppliers in ways that make you competitive, make your peers competitive, so you can keep making changes you need to. That's who we think we are. So I asked the question, and I was asked, who's your competitor? If you think that way, you're not just an EHR company. Who's the competitor? And we all get fascinated. You go to Forbes.com, they always compare one company versus the other. And the list that they love to put is the latest billionaire list and the latest millionaire list. That's how they compare. That's what they think competition is. So you love to see Coke versus Pepsi, who's winning, and then you find out SodaStream's winning. You go and look at Airbus versus Boeing, and you find out Embraer's doing well. And then this was the one that we all got captivated with, Apple and Microsoft, and who's winning and who's losing, and every decade there's a new story to tell. And those commercials keep changing. First it was the fat guy with the thin guy, and now it's the guy taking the laptop out and the one that you touch on. But this will go on. Competitors, we love to put one versus the other when we look at companies. Somehow ECW doesn't do that. So when you ask me a question, is it these Cerners, Epics, Meditechs? We go, no, they're fine companies. They're doing their inpatient, outpatient. We do our outpatient and patient, and we do well. Is it other ambulatory companies? We go, no, that's not it either. Are these other patient companies or population health companies? We go, no. Is it any one of these? And we say no. We've just had one focus. We develop all these technologies ourselves, integrate them in a supply chain where you can have and your customer can have an ultimate customer experience. We believe our competitor is time. We need to work with you next year to get a lot of what we talked about in those user experiences implemented. We want to make it easy on you. I know it's hard. I never said change was easy. But if we pull together, you and I partner, we will change healthcare. Healthcare's time will come, not just the industries of devices and commerce and music and TV. And you and I will partner to make for an amazing healthcare system with technology. What we have coming up for you is a very, very, very powerful product showcase. You know that's the whole thought. But before I go, I want to ask you a question. And it's going to make you think, because this is not easy. Change and being the torchbearers is a hard problem. You've partnered with us. We've taken on this responsibility. It is not common for too many companies our size to stay private and focused. It's a lot easier to IPO and exit. We've decided to stay the course. So I'd like to read, which I never do. You know, I just spoke to you, completely ad-lib, impromptu, no rehearsals. But when I went to the commencement, I had to write it down. I had to be perfect on that day. I'll read you a paragraph that I said, which in a way talks about your commitment and time. And after that, we're going to move on to the product showcase. Is that okay? Life's full of competitions. You will drive yourself crazy trying to win them all. But the ones that really matter, the ones that are of significant relevance, are the ones that focus on family, friends, and your communities. In this case, I'll say your patients. In the competition of life, you'll have many successes and some setbacks. There'll be many turns you take, but most of them pointing forward. Many times on this journey of life, you will feel your time has come, and you have reached the pinnacle, and that you have made it. Don't stop. Don't let individual goals and accomplishments be your measuring yardstick of success. Your next milestone will be much broader and far more important in scope as you begin to help others. Share your secrets to ensure the success of those around you. Widen your sphere of influence. I hope in a few years when we meet again, we reflect on our careers and the impact we've had on others not so fortunate. Be entrepreneurial, be brave, conquer your dreams. Don't let short-term gains influence your destination. Be steadfast, be strong, and your time and my time will come. Thank you this morning. Thank you for allowing me to speak to you. Wow, now I'm going to move to the excitement part of it. Done with the emotional part of my vision of what we care about. The most exciting product showcase, 16 plus demonstrations for you. We will blow you away. I would like to invite on stage right now Dr. Raj Dharampuria and Samir Bhatt. You've seen these two people on stage before. They're going to join me.